Histaflex is a combination product that contains acetaminophen and an antihistamine. Acetaminophen helps to reduce fever and mild to moderate pain, such as headache, backache, and muscle strain. The antihistamine in this product may cause drowsiness, so it can also be used as a nighttime sleep aid. It can also help relieve allergy or cold symptoms like watery eyes, itchy eyes/nose/throat, runny nose, and sneezing. It is important to note that cough and cold products have not been shown to be safe or effective in children younger than 6 years. Always consult with a doctor before giving this product to children. It's also important to carefully follow the dosage directions to decrease the risk of serious side effects, and do not use this product to make a child sleepy. Be sure to ask your doctor or pharmacist about other ways to relieve cough and cold symptoms. When taking Histaflex, it's important to follow the directions on the product package or as directed by your doctor. You can take it with or without food, and if you experience stomach upset, taking it with food or milk may help. If you're using the liquid form, make sure to measure your prescribed dose accurately using a medication measuring device or spoon. Don't use a household spoon as it may not provide the correct dose. For extended release capsules, swallow them whole and do not crush or chew them, unless your doctor or pharmacist advises otherwise. The dosage of Histaflex depends on your medical condition and how you respond to the treatment. It's best to take this medication at the first signs of pain, and for adults, do not take it for pain for more than 10 days, and for children, not more than 5 days, unless directed by a doctor. Similarly, do not take it for fever for more than 3 days unless directed by your doctor. If your condition persists or worsens, or if you think you may have a serious medical problem, seek medical help immediately. Common side effects of taking Histaflex may include dizziness, drowsiness, constipation, stomach upset, blurred vision, or dry mouth, nose, or throat. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. It's important to note that if your doctor has prescribed this medication, they have determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's crucial to seek immediate medical attention if you experience any serious side effects, such as mental or mood changes, like confusion, or difficulty urinating. While it's rare, a very serious allergic reaction to Histaflex may occur. If you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing, it's important to seek medical help right away. It's also important to remember that this is not a complete list of possible side effects, so if you notice any other effects not listed here, it's important to contact your doctor or pharmacist. And finally, if you're in the US, you can report any side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Histaflex contains acetaminophen, which can cause liver disease if taken in excessive quantities. Adults should not exceed 4,000 milligrams, 4 grams, of acetaminophen a day. If you have liver problems or are giving it to children, you should take less acetaminophen. It is important to ask your doctor or pharmacist about the safe dosage of acetaminophen for you. Avoid using any other medication containing acetaminophen without consulting your doctor or pharmacist first, as it is a common ingredient in many over-the-counter and prescription drugs. If you are unsure, check the labels on all your medications and ask your pharmacist. If you accidentally take too much acetaminophen, seek medical help immediately, even if you are not experiencing any symptoms. Overdose symptoms may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing eyes/skin, and dark urine. Regular alcohol use, especially in combination with acetaminophen, can harm your liver. It is best to avoid alcohol while taking Histaflex. Before taking Histaflex, it's important to talk to your doctor or pharmacist about any allergies you may have, as well as your medical history. This includes any breathing problems, glaucoma, heart disease, high blood pressure, liver disease, stomach or intestinal issues, overactive thyroid gland, or urination problems. Histaflex may cause dizziness, drowsiness, or blurred vision, especially when combined with alcohol or marijuana. It's important to avoid driving or using machinery until you know how this medication affects you. It's also important to be cautious with liquid products that may contain alcohol, sugar, or aspartame, especially if you have diabetes, alcohol dependence, liver disease, phenylketonuria, PKU, or any other condition that requires you to limit or avoid these substances in your diet. Parents should be aware that children may be more sensitive to the side effects of antihistamines, and in young children, this drug may cause agitation and excitement instead of drowsiness. Older adults may also be more sensitive to the side effects of this drug, especially dizziness, drowsiness, confusion, constipation, or trouble urinating, which can increase the risk of falling. If you are pregnant or breastfeeding, it's important to discuss the risks and benefits of taking Histaflex with your doctor before using this medication. It's important to be aware of potential drug interactions with Histaflex, as they can change how your medications work or increase your risk for serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription/non-prescription drugs, herbal products, and any antihistamines applied to the skin, ketoconazole, or levoketoconazole. Also, let your doctor or pharmacist know if you are taking other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or other antihistamines. It's important to note that antihistamines are found in many non-prescription products and some combination prescription medications. Always check the labels on all your medicines, such as allergy or cough and cold products, because they may also contain an antihistamine or other ingredients that cause drowsiness. If you have any questions, ask your pharmacist about using those products safely. Finally, it's worth mentioning that Histaflex may interfere with certain medical/lab tests, possibly causing false results. Make sure lab personnel and all your doctors are aware that you use this drug. If someone has taken too much Histaflex and shows serious symptoms like passing out or having trouble breathing, it's important to call 911 or a poison control center right away. In the US, you can call the local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an overdose may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, agitation, confusion, flushing, hallucinations, yellowing eyes/skin, dark urine, and seizures. In children, excitement may occur first, followed by loss of coordination, drowsiness, loss of consciousness, and seizures. Always seek medical help if you suspect an overdose. It's important to follow your doctor's instructions and not to share Histaflex with anyone else. Make sure to attend all your medical and lab appointments as recommended. If you take Histaflex regularly and happen to miss a dose, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take your next dose as scheduled. Don't take a double dose to make up for the missed one. It's important to stick to your regular dosing schedule for Histaflex. When it comes to storing Histaflex, it's important to keep it at room temperature and away from light and moisture. Make sure not to store it in the bathroom and avoid freezing the liquid forms of the product. Also, be sure to keep all medications out of reach of children and pets. When it comes to getting rid of Histaflex, it's important not to flush it down the toilet or pour it into a drain unless instructed to do so. It's best to properly discard the product when it's expired or no longer needed. If you're not sure how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.